Thank you. Imagine for a moment what it would be like to survive on only $9 a day in the United States of America. For 20 million Americans, this is not simply an exercise in imagination, but their actual lives. We, our team, our Catalyst team, is a group of social, medical, and data scientists who really care about this problem. And we think that we could launch a new smart war on poverty by bringing to bear the tools of the Silicon Valley and the tools of data science. Why do we care? Why should you care? The first is the moral imperative. Poverty translates into untold lives lost, untold medical and health condition costs, untold potential lost. This is just unacceptable in the world's wealthiest country. The second reason we should care about poverty is the economic imperative. Poverty turns out to be really expensive. We spend about 1/4 of our federal budget, $1 trillion, on anti-poverty, means-tested programs. Not only that, we lose about another $1 trillion, $750 billion in the cost of just foregone employment, medical bills, and other externalities. Poverty is expensive, but what that means is because the costs compound, if we could move the needle just a little bit on poverty, we could have big repercussions economically and morally. If we could reduce the poverty rate by just 1%, for example, we could transform the lives of about 3 million people. And we could save or increase the GDP by about $54 billion. That's the hope. That's what we think we can do. Can we do this? How can we do this? In thinking about this problem, we were inspired by lessons from another domain of human concern, health, and the revolution underfoot in what's known as precision medicine. Now, this revolution is still underway, but headway is being made. There are 3 lessons that we are drawing. First, progress accelerated when we made a big funding commitment to research, to really understand the etiology of diseases like cancer, cystic fibrosis. Second, we realized that what we had once thought was a unitary problem was actually many things. There was not one type of cancer or one type of disease, but many, heterogeneity. And finally, a lesson whose potential has yet to be realized is the ideal of personalized treatment. Personalized treatment, attuned to the specific underlying condition at work, can revolutionize treatment, leading to breakthroughs. These 3 lessons form the intellectual bedrock of our research, or our proposal rather, is not just research, the Catalyst National Poverty Study. It's not just the most comprehensive, most ambitious study of poverty in America ever conducted. It's much more. It's an infrastructure for reducing poverty in the United States of America. It will be a standing laboratory for poverty analysis and experimentation, not just for the next 3 years, but for decades to come. We will bring big science to bear because right now our understanding of poverty is based on thin data. We will bring improved classification because right now our understanding of poverty is oversimplified. And we will bring the ideal of personalized treatment, because right now we're proceeding more or less on a one-size-fits-all treatment of poverty. We need to understand better what works for whom under what conditions so that we can spend the same amount of money but more effectively, more precisely, in a more leveraged way. That's what we're going to do with the Catalyst National Poverty Study, which will sample a large representative sample of 5,000 households and their families dispersed throughout the United States across 200 sites. We're going to have a large team administer a protocol for the entire year, for an entire year of data collection. And they will go out across the country to administer this protocol. They'll be highly trained, and they'll go to 5,000 households distributed across 200 sites throughout the country. What will we get from this? Well, first, a wealth of data. Data from every major level of disciplinary analysis. I love this slide because it captures how each individual is nested in multiple levels of influence, not just they themselves, them personally, the company you have to keep, you as an individual, but your social environment, the fabric of your day-to-day life, the institutions you come in contact with. We are nested. So in this study, we will collect individual level data, genomic data, epigenetic factors, psychological data capturing the subjective experience of poverty, not just the objective conditions, skill sets, social and emotional intelligence, health data. Research shows that these individual level factors really matter, and we'll collect them. We'll also move one level up to the social level, collecting data on the family, such as social support, hugely important for coping with harsh conditions. Social networks, because our digital context is an increasingly pervasive part of our lives, such as on LinkedIn and Facebook. We'll collect these data, and neighborhood data from Google Street View and census data. We'll be collecting this too to capture proximity to resources, the availability of opportunities, social disorder and social capital. These are things that research says in the social sciences, especially at Stanford, are really important, but we lack quantitative measures of these things at scale. And finally, institutional level data, social programs, job and labor market turnover, exposure to environmental data. That's not all. We will also have an intervention, a suite of interventions based on social psychological research showing the power of brief but timely interventions that can open people up to new directions and new possibilities by changing the way that they construe or perceive their environment. These kinds of interventions turn out to be very effective for some people under certain circumstances. Our research will serve as a potential proof point that precision targeting is possible, first with these interventions, but also with interventions being conducted more naturalistically throughout the country. And finally, the outcome data that we're going to predict, earnings and income data, employment, credit data, a wealth of data so that we can trace the trajectory of people's economic states through time. We have funding for some of this, but far from all of it. And most research to date has looked only at one level of analysis. We have an understanding of each level that's very thin, and we don't know how the levels interact. But we need more than big data. We need big analytics to understand how it all works together. And for that, I'm going to turn things over to Jure Leskovec, my PI. Co-PI.
Great. So how are we going to do it? The goal is, if we really want to truly understand it, then we should go and try to change it. So all this data that we are going to collect has never been collected, never been integrated, and it has never been analyzed. And by doing the analysis, it will allow us to build models that will allow for kind of precision treatments of poverty based on different types, individualized to different households. Our project has 4 different steps. we want to first go and identify what are different types of poverty. So basically realizing that there is not one disease of poverty, but there are many different types and manifestations, we want to understand which are those. Then we want to go and identify pathways into those types of poverty, but more importantly, what are the pathways that lead out of those types of poverty? After we have identified the pathways and the types, we are going to build risk models that will allow us to predict at an individual level what is the risk for each of these different types of poverty. And then based on the predicted risks, we'll go and suggest treatments in this personalized way. So first, what do we mean by classifying poverty types? Prior research all assumed that poverty is this kind of homogeneous one type of phenomena. And there was a lot of research only focusing on one variable and kind of one type of data and trying to argue that this is the right way to understand poverty. Our view is different. Our goal is to realize that this is a very heterogeneous phenomena and that we first have to go and map it out. We have to identify many different types of poverty. Right? So for example, we may identify that there are many psychological reasons for poverty. For example, addiction, depression, wrong type of a mindset, or social isolation. For example, we may further discover that there are also many different structural reasons for poverty. For example, deindustrialization, high housing cost, or high income inequality in the society. All these different types of poverty we'll be able to identify. Based on this, we will realize that there is not one type of poverty, but that there are many different types, and that there might be different pathways that lead to each different type of poverty. For example, childhood trauma may lead to the poverty that is associated with addiction. There might be pathways to poverty due to inadequate education, lack of jobs, or due to the limited cognitive bandwidth. By identifying these pathways to these different types of poverty, we will then start thinking about personalized treatments, right? Building personalized risk models for different types, and then define personalized interventions. So the goal is, if we know who's at risk, then we can develop personalized treatment regimes specifically tailored to them. And those regimes may also be heterogeneous. There is not only one treatment we may apply, but we may kind of apply a cocktail of treatments personalized to a given person. Examples of treatments are housing vouchers, job training, or mindset type interventions. And this may work differently depending on the individual and depending on their situation. So for example, for some people that are in an economically rich environment, but they just need an encouragement to go seize those opportunities around them, a mindset type intervention might work well. While for certain people where there is skills mismatch, new job trainings might be the right way to proceed. And what this will allow us to do is it will allow us to relocate spending dollars from current inefficient programs to the ones that work better and have higher payoffs. And this is important because targeted treatments are likely to be mandated by the governor of California, and we need to develop capability to be able to target anti-poverty treatments. And if we do this successfully, we'll become a role model for the entire country. Here is our schedule and how our project is going to go. So we are already collecting pilot data, and we are refining our data collection protocols. We will use this pilot data to also do preliminary analysis and develop neighborhood measures and metrics so that when the full-scale data is collected, we can actually achieve what we aim to do. So our goals will then be to pre-test the data and prepare the analysis so that in the year 2 we can do the full data collection and analyze the poverty types, and then in year 3 do the prediction of poverty risk, identify the pathways, and then build these models of personalized treatments for poverty. We also have a great interdisciplinary and committed team of experts in poverty, genomics and epigenetics, data science, and psychology. And we are all committed to work together because we think we are at one of these rare moments in history where by different disciplines coming together, we can really solve a very important problem. So to finish, it's been argued that reducing poverty in the United States would simply cost too much. If our personalized treatments work, even modestly, we think we can significantly reduce poverty without increasing poverty budget. But it's also more important than just money. It's about reducing the amount of human suffering, helping as many people as we can, and making 21st century a bit more hopeful place. Thank you so much.
Question is there a budget for the interventions? They could be expensive depending on what you want to do. Housing vouchers, I saw as one of them, but I was wondering if you consider something as far as universal basic income experiments.
I would say that the data should speak to that very question. If it's indeed the case that providing a cash assistance of that sort to everyone is the highest payoff, the best way to allocate our funds, then indeed that would be the recommendation that would come out of this data analysis.
Thank you very much for a very interesting proposal. My name is Manpreet Singh. I'm a psychiatrist in the Department of Psychiatry here at Stanford. And one of the things that we really struggle with, particularly in patients and families that are affected by some of the issues you describe here, is a workforce shortage. Not enough mental health providers that are available at the front lines to be able to implement your treatment phase. I'm curious to know how you've thought about that problem and how you might consider potential solutions.
Well, again, I think we are trying to approach this in as free from preconceptions as possible. If indeed the data speak that that type of ramping up of that type of capacity is indeed the highest payoff ramp up, then that would be the conclusion that would come out of the analyses. Our suspicion is that indeed it won't be a simple sort of analysis or conclusion of that sort that pertains to everyone, but rather that for some people those sorts of responses are high payoff, and for others it might be that others are.
And we have a suite of psychological measures to assess the role of mental health and thereby examine the degree to which different conditions matter for different kinds of psychological types.
Yeah, it's also, I think it really speaks to the benefit of the 200 sites design of this study, because as you know, with any kind of workforce mismatch with an area, that's going to be something that's going to vary over cities and over sites. And so we're going to have a lot of leverage for being able to look at precisely that.
And just to add, right, I think the important thing here is that we are not going in by one preconceived notion of what is important to eradicate all of poverty, right? So this answers kind of in some sense both of the questions, because there is already, for example, in our large sample, there will be people who are getting adequate mental treatment. And if the data shows that for a certain group of people with certain characteristics, mental health treatment is important, we'll be able to identify that. At the same time, there are kind of monetary assistance type programs throughout the country already. So through that, we may be able to learn whether the universal income works for certain groups or subgroups of people.
Thank you. Really interesting and important work. I'm curious how much of the focus is, it sounds like it's a lot on treating poverty. How do you plan to approach preventing poverty? And is there an attempt to look at resilience to poverty involved in this?
Well, there are two points of leverage with respect to examining the effects of different treatments. We'll be carrying out some experimental interventions of the sort that Jeff discussed, and we'll see to what extent relatively low-cost interventions can have outsized effects. But also running across the country right now are lots of experiments across the different states of the country, in which we have different regimens that are already in play, and we can use high-quality, quasi-experimental approaches to assess the payoffs to those types of, as it were, natural experiments. And so we have a lot of data that has not been mined to this point, in which from which we can glean the extent to which these interventions, if you will, are having a payoff. So thank you all for a great presentation.
Thank you.